Good afternoon. I'm Dr. Venice Omona, the head of pediatrics department at St. Mary's Hospital, Lacor, and also double as the deputy medical director for clinical services. What else is being done? Recently, as a country, we rolled out the malaria vaccine, and we think this is going to really help us in the fight against malaria. This vaccine is supposed to be given in 4 doses, so at 6, 7, and 8 months, and then at 18 months, a 4th dose is supposed to be given. Okay? But from the different phases of the trials, it has been shown to reduce the frequency of infections, but also reduce the severity of these infections, and also reduce deaths by almost 13%. So we think this is really a game changer if we combine this together with the other preventive mechanisms that have been preached in the past, like use of insecticide-treated mosquito nets, things like clearing bushes and stagnant waters around, our homes. All these things like indoor residual spraying. Okay, so all this put together with the vaccination, we think it's going to really have a major impact, and we think it's going to significantly reduce the burden of this. Of course, the other thing is prompt testing and prompt treatment. So there does not have to be a delay. Okay, if someone presents with signs that you think is likely to be malaria, this person should be tested immediately, and if it's positive, treatment should be started promptly with the correct medicine at the correct dose. So all this put together with this new vaccine, we think is going to really have, a very major impact on what we see now. In the department where I work, in the last financial year, a quarter of the admissions that we had in both the children aged 5 years and below and those above 5 years was due to malaria. And malaria continues to be one of the leading causes of deaths in the hospital, obviously because of all the complications that I alluded to earlier. So we think if we put all these preventive measures together with the new vaccine, prompt diagnosis and treatment, this is really going to be a game changer. Of course, to the public out there, yes, this is a new vaccine, okay, but we encourage that you need to embrace this because malaria has been with us for a very long time. It's been years of struggle to come up with a vaccine that, would help. And I think this is the time, this is the opportunity to exploit this opportunity, this innovation. Let's embrace it. Let's take our children to get this malaria vaccine, which I think is going to have really a huge boost in all the fights that we have had. There are also people who out there who think malaria is a usual thing because they have been hearing about it. They don't think it's a very serious condition that can lead to. So we need to emphasize that, yes, it's been there, it's still there, but it's preventable also. It can also be treated, but we also need to take it with all the seriousness that is required. Thank you very much, and thank you again.